What we're going to do is, with our back to the sofa, I'm going to get on my knees. Very good. I'm going to gradually lean forward. I'm going to rest my elbows. I'm going to put one foot here, another foot here. I'm going to lean back, and in this position, I'm going to keep the pubic symphysis, which is this part down here, well pressed. As you can see, just this position alone is causing a curvature in my lumbar spine, but also stretching the psoas muscle. So, what am I going to do? If I want to increase the tension on this psoas stretch a little more, what I'm going to do is go a little higher. In other words, I grow, and once I make this movement, I'm already feeling the tension in the psoas there. How long am I going to hold it? 3, 4, 5 seconds, and I'm going to do 15 repetitions. I'm not going to do more than 15 repetitions because then there would be a second exercise. So I'm going to show you an adaptation of this, which is a bit more complex and more intense. It doesn't work for me because I'm very stiff. I have the Tyel syndrome, that is, I'm very rigid and don't flex. But we can do this. You see here I'm doing it wrong because I'm lifting the symphysis of my pubis. I'm doing it wrong. So what I want you to see is that at all times it should be well supported, the pubic symphysis on my mat. If I lift that pubic symphysis, I'm doing it wrong. So, what do I have to do? Adapt. This is the position that would be good for me, or here without extending the elbows, but without lifting the pubic symphysis, and I maintain 1, 2, 3, 4, 5, and relax. I'll tell you that for me this position is very, very, very tense. It's hard for me because I don't have much flexibility, but I adapt to it, as many of you will. Let's do 15 repetitions, 2-3 seconds, as I said here for those like me with a Tyel syndrome. Here for those who can stretch a bit more. And for those who are able to. Base of the pubis, this one, very simple. 15 repetitions, 3 little seconds. What will we notice? Well, we'll notice all the tension from the psoas stretch. Now, I'm going to move on to a second exercise. I'm in the same position, and what am I going to do? Well, the right leg, in this case, I'm going to place it here. All right, I'm going to place it here, and I can already feel my psoas stretching, especially on the opposite leg. There. Why? Because by grabbing this leg and placing it higher, we're creating a greater lever arm, which is causing more tension. We hold this here too, and we'll repeat it 10 times, 10 repetitions, 3 seconds, on each side. We start here, I start here. Keep one thing in mind, I don't have much mobility. I could do it here, it would be the next step, and for those of you capable of pubic base, this is fine, very simple, perfect. "15 repetitions of this, back here, and now we switch to the other leg. 15 of this, very good. Here I seem to feel a little better. Hold for 3 seconds and relax. Go back again, hold for 3 seconds and relax. One more, if I see that I can go a little further, I place it here without lifting the pubic symphysis, 3 seconds and relax, very good. Once we've done these 2 exercises, we won't do any more lying down. So now let's move on to the third exercise. For this third exercise, we'll need a towel. As you can see, we'll place it right in front of our sofa or our bed. What are we going to do? We're going to do a knight's position. That is, we're going to place our left knee on the towel. We're going to place the instep right on the edge of our bed. And we're going to advance our right leg, giving us good stability, making ourselves comfortable. And from here, what we're going to do is lean our body forward. When we do this lean, we'll notice our psoas activating, and then we return back. We'll do this 8 times, 5 seconds each. 1, 2, 3, 4, 5, relax. 1, 2, 3, 4, 5, relax. Again. 1, 2, 3, 4, 5, relax. We'll do this for 8 repetitions. If we want to use another variation, it's very simple. From the same position we're in, what we do is lean forward and make a small trunk rotation to the left side. This will increase the tension in our psoas, and we'll feel a bit more tension in that area and activation. Simply looking forward, hands crossed or on the hip, lean and rotate. And finally, if we want another one, well, all we have to do is place one hand on our head, lean forward, the other hand on the hip, and lean laterally. It would be something like this. We switch and do it with the other leg for you to see, and we'll do 8 repetitions of any of these variations. It doesn't matter, you don't have to do them all. Choose the one you like the most, precisely from this exercise. Very good. Remember, forward lean. Rotation. Rotation to the opposite side. And lean. Lean forward and rotate. Those are the 3 variables you'll find. They're very simple. Choose one and do 8 repetitions for each leg. We won't do any more sets. Why? Because it's intense, and as we become more adaptable, we can do more sets or more repetitions. It's very important to know what mistakes we can make here. Well, a characteristic mistake, and it's very easy, is that due to the tension we have, we're not able to finish the exercise, and what we do is lean our trunk. We lean our trunk instead of leaning forward with our hips. Not this. Also that in the end we can have a lot of rotation of the leg inwards, outwards, which is not interesting, or we lose stability. Any exercise indicating that we're losing stability means we're not ready to do it yet. Therefore, we'll do the exercise that is much simpler and easier. Remember that we'll always do it on both sides. Always on both sides. So, this exercise with its variations, now there's no problem. We've done these 3 exercises. Let's move on to the 4th, which is simpler. It will also allow us to have good activation and flexibility of the psoas. In this other exercise, you'll see that it's also very simple, and all we need is either a stool or a low bed. In this case, well, you have a low bed at home. What are we going to do? We're going to lean as close as we can to that stool, and we're going to flex our hip until our foot is completely resting on that stool. In this position, upright, stable, with a core fully activated and straight back, we can do it from this position, and in that way, we'll also have a thoracic opening. What we'll do is a small lift, 3-second lift and lower, lift for 3 seconds and lower. If we find ourselves a bit more unstable, we can get a little closer and grab our hands on our waist, and that way we'll feel more comfortable. 1, 2, 3, relax. 1, 2, 3, relax. How long are we going to do this? We'll do it for 20 seconds on one leg and 20 seconds on the other. We'll rest for 1.5 minutes, and we'll repeat 20 seconds on one leg and 20 seconds on the other. This way, 1, 2, 3, we have a little stopwatch guiding us, and we do this movement for 20 seconds. There, to activate the psoas, well, you'll notice how it activates, and as we keep doing this exercise, which is like climbing very steep stairs, we notice how it activates more. Once we've finished, we'll go to the other leg and do the same thing. There, 3 seconds. 3 seconds. There, 3 seconds. We hold and we do it for 20 seconds. Once we've finished this exercise, we rest for 1.20 minutes, and we do the exercise again. What mistakes can we make? That the height is too high, so we lose stability. We lower the height until it's as low as possible, as if in the end the only height we have is this. Well, we imagine that we only have this. From here we position ourselves, and if we feel more stable here, we do it here, no problem. That's what heights are for. To be able to gradually dose and switch, very good. It's a simple and very easy exercise that for whatever reason doesn't cost us anything, and we want to add a little load. From this position, we can place a weight here or with the resistance of our hands, and we push downwards. I try to lift my knee as I go up, and with my hands I resist. There. Very good. Perfect, and I would switch. That's 20 seconds of work. 3 seconds up. 20 seconds of work. 3 seconds up. If you see that you don't have stability, that you fall, that you're not able to maintain the position or do the exercise, I'll give you another, much simpler, seated, and it's okay. And we do it here seated. 20 seconds. All right, and 3 of activation. You always have to adapt. That's the most important thing. So exercise is adapted for everyone. Maybe the first ones will be difficult for you or for me. As you've seen, they were also difficult for me. So I start with some simpler ones. That's why I give you variability. And finally, to pair with the final exercise of all, we're going to use a mat. It's an exercise that I've also shown many times for the paravical level. But in the end, it's about being able to use it based on what happens to us and the injury we have. We're going to lie down on the floor, very good, hands supported on the mat. And from this position, I'm going to do 30 repetitions and hold up for a long second. 1, 2, 3, 4, and you'll see how as I lift my pelvis I'm ultimately causing a stretch of my psoas muscle due to this lever and this extension. Very good. If I want to make it a bit more complicated, it's okay. What I do is I extend my knee. And when I do this knee extension, my left knee should be aligned and my right knee, that would be about 45 degrees, and I do the same here. It's just left on this side. When we do it unilaterally, instead of doing it 30 times as we did here we'll do 10. And once we've done the 10 repetitions, we support the foot, extend the opposite leg, and do another 10. If this one is very easy for us, and we're totally comfortable, and it's simple, then we go directly to this one. If we see that we're not able to do this one, it's okay. We stay here until later, and in the future we can do it.